And we're at Circuit World here in Blue Ridge, Georgia, and it's time for Ask the Doc with Dr. William Whaley, and from Northside, from North Georgia Cancer Research Center, affiliated with Northside Hospital.
Boy, you got a mouthful there, huh?
You know, I'm trying to make it roll this morning, and it's a little difficult.
Yeah, put your glasses back on. You would do better.
We can't get into them.
Hell yeah, there you go. All right, good.
I can't see the teleprompter. You know, most of the networks, which they're big and got all that money behind them, there's this big teleprompter. You're reading that right from.
Oh yeah, no, I've done it.
I got to do it right from.
Yeah,
this is the only teleprompter
I did 24 hours for leukemia and stuff with Shirley Jones. I know all about the teleprompter. Tell me what color that is in our teleprompter up there at the sky. Is that that's the leaf changing colors there? You know.
Absolutely, it's beautiful.
Yeah, they're beautiful. But is that rust, or is that a multiple colors of red?
That's
pink,
rust.
Rust. Okay. And now, if that's rust, then that's got to be yellow beside it, and then brown underneath, and then yellow on the side over there.
Are you using that for an eye chart?
Yeah.
Oh, I just wondered.
I just wonder if you had your glasses on. Okay. I just checking your vision. Since there's no teleprompter and we're looking at the mountains.
Fire on the mountain.
We're looking at the mountains. So instead of a teleprompter, right behind that camera are gorgeous North Georgia mountains.
Actually, it's still beautiful up here, and it's always beautiful. But, I mean, if you're coming up and you want to look at leaves, there's still that. And now the only thing is we know Mother Nature is the leaves change color, and then what will we have? We'll have some pretty hard rains or some rain come through.
Tomorrow they're going to be gone because it's going to rain. It's going to rain an inch of rain tomorrow. By Thanksgiving Day, that'll be skinny trees. All right.
So, Dr. Whaley.
You can't pronounce this first word you said here.
No, I can't with glasses, no glasses. I would have to call a friend if I was on that show. I'd have to phone a friend, and I'm going to say most of my friends probably can't pronounce it. Our first question, sir.
All right. I guarantee you, this is a great question, by the way. I guarantee you this came out of those questions where we were talking about indolent lymphoma and watch and wait. Remember all that?
Right.
The treatment is watchful neglect because there's this condition they're talking about here that says, my mother has had monoclonal gammopathy of uncertain significance. Remember, we talked about Muggus. Remember Muggus? That's what that is.
Right.
Muggus, okay. Monoclonal gammopathy of uncertain significance for 12 years. And now is to go on treatment for multiple myeloma. All right, you remember that?
Yes.
Okay, I mean, I'm not going to make you do the show here, but you remember we talked about Muggus, we talked about progress to multiple myeloma, but this gets into the meat of the thing because this lady listened, and her PET scan says she has disease in all of her bones.
Mm.
Her boyfriend is a retired surgeon. Important, right? Surgeon. And she is 75 years old, so she's still got some moxie. She's got a boyfriend, right? He told her she had cancer all over her body and to go on hospice. She feels great, so she doesn't feel bad. Should she take treatments or not? Now that's a pretty meaty question, isn't it?
Yeah, I mean,
think about it a second. There's a lot of pieces to that. A lot of pieces to that question.
Now, if you're asking me, first of all, you know, I understand. Let me just say this. I understand when something happens, all the questions that start going around, you know, hey, I'm 75. You know, I had a friend of mine one time say to the doctor, okay, if I'm 75 because they were around that age. If I take no treatments whatsoever, how long do you think I could possibly live? And she was told X. And then she said, well, what if I take treatments? How long could it prolong? She was told X. And she personally made a decision that between this answer and that answer, she was satisfied with living out her life. Now, yeah, but that's a decision. But I think what's important here is this is a surgeon.
Right. There you go.
Okay.
You got
Right,
it.
because
Bonnie, you got it.
let me see if I can
right.
get a little closer to being right. When you first are diagnosed or you're first feeling you need to go to a doctor, your doctor refers you to a surgeon if needed.
Right. If it's
The
something
first
else.
thing you go, right.
Some other kind of disease.
Right. So, well, I mean, you could go to a cardiologist. You could have problems. It's not till you get to this point where they bring in the surgeon.
Yeah.
So the first thing is your boyfriend, which probably a not very knowledgeable person, is a surgeon.
Yeah.
So-
But he got no more knowledge of this than Lonnie does over there.
Exactly.
I hate to tell you. All right. So
okay.
basically what the concept of that is that multiple myeloma
I apologize for that.
is by definition all over the body, always. And when the surgeon's thinking about cancer that's all over the body, like, pancreatic cancer or something, it's a totally different animal. So first thing I'm going to do is say we're going to forget about the surgeon. Get up that thing about the gateway, if you will, Lonnie. You'll remember that we talked about monoclonal gammopathy of uncertain significance, and what that means is you have in your blood a protein that is made by one clone of cells and therefore is technically a pre-malignant or a malignant condition. And I use this analogy. If you go to the Falcon football game, remember that? Mm-hmm. And if the thing holds 88,000 people, and most of them are over age 50 because the tickets are expensive, 4 or 5% of the normal people in that stadium will have monoclonal gammopathy. They don't know it. They only would know that if you were doing some sort of study on. Pull that one down, honey. So here's the story. This is probably the risk of progression with monoclonal gammopathy to multiple myeloma is
1%.
1% per year. In other words, very few patients that have monoclonal gammopathy will progress into multiple myeloma. Now, the fact that it has taken, did she say 12 years? 12 years. Okay, so this is a real indolent or slow-growing type of myeloma. Lonnie, you need a few of those antihistamines over there, don't you? All right. So, all right. Now, let's go to the next picture here. You see this is a skull.
Right.
That skull has got a solitary hole in it. And you don't have to be a radiologist to see that hole. Lonnie, you got that up there? That hole in the head, you remember we a few weeks ago, we had this exact discussion when we were talking about monoclonal gammopathy before, is you can have a solitary plasmacytoma that's not multiple. Remember we had somebody, I think, that had it in their arm or something, and that was the only place in their body they had it. They gave them a little bit of radiation therapy, and they'll probably never have another problem as long as they live. So this is in the skull. That person doesn't have the foggiest idea there's anything in their head. They don't have a headache. They're not dizzy. They don't have squat. They took an X-ray, and that bone is thin in that region right there. And if that's the only place in the body, you can radiate that, and that'll be the end of it. Now go to that arm there. I haven't seen a patient that looks like this in 20 years, but this is real full-blown bad multiple myeloma. You see that elbow?
Yeah.
I mean, that thing is just packed full of holes, right?
Yeah.
Now you can imagine that arm hurts.
Yeah.
Yeah, that arm probably hurts. Okay, pull that one off, Lonnie. Let's be without here for a minute. So the fact that mama feels great, that's number one. Number two, she's been followed for 12 years. So that means she's got a relationship with a treatment team that has watched this muggus very slowly progress to multiple myeloma to the point that they believe her best interest would be served by treatment. The one thing they don't say is exactly what they are going to be doing for her. So put up this next one here. I'm not going to make anybody spend a whole lot of time on this, but you'll notice that they got, in this multiple myeloma current treatment thing here, you've got what they say first-line treatment, relapse treatment, refractory treatment, on and on and on. You see these things?
Yes.
All right. In this age group of 75, slowly progressive MUGUS to multiple myeloma, I have a patient that this past week reached that spot, and that patient's going to take a pill, one a day, 3 weeks on, 1 week off. I know you're familiar with this treatment because we talked about this with your family member, that you're treated for a few days and then you got 21 or 28 days to do something. So this particular drug is called Revlimid. It's kissing cousins to thalidomide. You remember thalidomide? That was the drug way
How can
back.
I forget?
Thalidomide, no, thalidomide's that drug that they gave women to sleep, and the children were born with the funny arms. Okay, so that drug obviously stopped development of embryos in the womb to make limbs. I mean, obviously has a stop. It obviously has a stop something effect. Well, it stops these plasma cells from growing, and it has very little in the way of side effects. So many patients who have this is going to be smoldering myeloma now that it's gotten to this point, because the patient feels great. Didn't say she, bones all hurt, and she's weak and she's anemic. So she probably is going to begin a single drug like that. They're going to give that drug, and she's going to get better. She probably will never end up with multi-drug chemotherapy, never end up with a stem cell transplant, never end up with a very aggressive therapy that this patient with that elbow would have gotten. Are you with me?
Right, yes.
All right, so the concept that in this particular woman is, one, we have, by the way the question was asked, the knowledge that this has been slow in progress. We have the fact that she tells us that the patient feels great, that the performance status is good, and she did not say she's got brittle heart disease or diabetes or anything else. So I hate to keep going back to George Burns. You remember the George Burns analogy? Lonnie, you remember George Burns' analogy, right? When he was 75 years old, he was having relations with Las Vegas showgirls and did for 24 more years, right? Stopped when he was 99, died when he was 102. So we treat this 75-year-old woman like her biological age. So I would say the surgeon has a mindset. If he's her boyfriend, he's got to be old. He's got the old surgeon's mindset that if I haven't cured you by taking your breast off, or I haven't cured you by taking your stomach out, and your cancer comes back, nobody can help you because it has recurred. And that is a fallacious concept. And we would like this we don't know if the woman who's right. I asked him this question, is a man or a woman, do we? So whoever the person is, whether it's a man or a woman, your mother should be encouraged to take the treatment. I think you should not worry about her, and you might want to go to the conference with her oncologist or hematologist, whichever it happens to be, and discuss her progress and what they expect for her, but don't let the surgeon discourage you. Is that enough, Lonnie? You heard enough about myeloma to get you encouraged about the lady? Go on now.
No, I was thinking a couple things. I don't want to get sidetracked.
It's the same kind of disease as the other one you're thinking about, but this is much less aggressive treatment.
Right. And no, I was thinking, like I said, I don't want to get sidetracked. I might ask you something at the end, pending time. Again, we want to thank Northside Hospital, North Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment of Ask the Doc. Don't forget, you can send the doctor a question at info, I-N-F-O, at fetchernews.com, or put it on our social media page when you see at Fetcher News, Ask the Doc, or FYN TV, and we'll get it to Dr. Whaley. So the second question, my husband is 67 years old, and 10 years ago he took some took some chemo after surgery for colon cancer. He has had no problems since, but now has developed tendinitis.
No, tinnitus.
Yes.
Tinnitus. Yeah, that's
Okay.
ringing in the ears.
Oh, tendinitis would be somewhere else.
Yeah, tendinitis
Would
being your ankle, yeah.
Yeah, it would be in your ankle.
All right,
Okay,
go ahead.
Tinnitus, not tendinitis.
All right.
In both ears, and the ENT says old age. Is there anything he can do about it, and is the chemo related and responsible? So tinnitus, not tendinitis, that'd be in your ankle. Tinnitus. Is that something that was related to the chemo at that time, or what do you think?
I doubt it, but it could be.
Okay.
Now, tinnitus is ringing in the ears.
Right.
You got that?
Got it.
Now, that happens to a heap of people, doesn't it?
Right.
All right, so, and I'm going to say that tinnitus can be really mild over here, and just about anybody whose hearing is going, like the two of us at this table,
Right.
will have some degree of tinnitus as their hearing begins to deteriorate. Put up the poster child for severe tinnitus and treatment of severe tinnitus, and everybody who watches this program will recognize the poster child for fetchyournews.com. That's the poster child for tinnitus. Who is that?
Rush Limbaugh.
What do you see specifically about that picture that's not common for other people?
He has an implant.
Cochlear implant.
I was going to. I knew that. I just didn't want to butcher it up, because if I start cochlear implant. Yes.
Cochlear implant. So if you will take off the poster child's fetchyournews.com hero's picture and put up the next picture, this is going to get to be a lot of fun. That is an ear.
Mm-hmm.
And the ear starts way out here with this part, you see. Mm-hmm. And that's the eardrum, and those are those little stapes that move around in here. Then the cochlea is way in here up next to the brain, right? All right. There are so many different causes of tinnitus, only one of which is cochlear, and the treatment for Rush Limbaugh's type of tinnitus and deafness with that cochlear implant actually works. And he probably does not have any tinnitus anymore because of that cochlear implant. But that is less than 0.5% of tinnitus patients. You got it? All right. Pull that one down. We're going to put up a chart that's going to just plain old gag people. We don't expect you to be able to read it. But if you just begin at the top as to the causes of tinnitus, you'll be here all day trying to discuss all of them. So the first one begins with sensorineural hearing loss. Well, that actually is what happens when these bones get stiff and we get old, just like the gray hair and the knee hurts. All of this next thing is various forms of high blood pressure or atherosclerosis or things like that that can affect the portions of the brain or the hearing apparatus. Anything that affects bone, from from arthropathy, that's otosclerosis. Anything that affects the brain, there's German measles, there's a chronic ear infection. Any kind of metabolic, there's thyroid, diabetes, high blood pressure, any type of autoimmunity, that's rheumatoid arthritis. Anything that injures the cochlear is way down here at the bottom. And then at the last one it says drugs. Okay, pull that one down and let's put up 100 of your most common medicines. There is hardly a drug on this big list that somebody is not taking. Because if you begin up here at the top, you've got, this is your normal antibiotics like Cipro and Flagyl and stuff like that. This is your most common blood pressure pills. This is your most common anxiety pills. This is the high blood pressure heart pills. You go all the way through this list, all the way down to here. This is the over-the-counter Pepcid and things of that sort. At the very bottom, you get to salicylates. Okay, pull that one down and tell me what's a salicylate, Lonnie. Aspirin. So many people take aspirin.
Right.
Aspirin can make your ears ring. So, this patient has millions of things that could have caused tinnitus. And yes, chemotherapeutic drugs, while you're taking them, can generally cause tinnitus. But if there's been a 10-year gap between the time the drugs were taken and the time the tinnitus began, then the chemotherapy is not responsible, more than likely. But the question is not that. The question is there anything he can do about it? So let's go up to that one talking about breaking the cycle. I hate to tell you, but there's really not anything that can be done to cure the tinnitus if it's not due to a medicine you can stop, if it's not due to a chronic ear infection that you can treat. Most of them are not. If it is the common tinnitus that begins to occur at ages 50, 60, and 70, it can be so troublesome that it badly interferes with the quality of your life. It can interfere with your sleep and everything else. And the treatments are all what we would call behavioral medicine type treatments. One of the treatments is that you get a competing, what's that stuff you go to sleep with? White noise, that sort of thing. Or you can wear an earphone that plays crackles or waterfalls or something of that sort. But most of these begin with treating anxiety, stress, and depression. Because I hate to say that stress, anxiety, and depression are one of the, and that was on that list, are one of the largest causes of tinnitus, or tinnitus then causes you to have stress and depression because it's bugging you so much, so that there are behavioral treatments with medications that help treat stress and anxiety. And lastly, remember biofeedback?
I don't know. No.
Yeah, you do. I said, remember, you can teach somebody how to beat the lie detector.
Oh, okay.
Yeah, okay, because that's your skin resistance and heart rate and everything. Biofeedback is stopping the heart rate response or the skin response or whatever it is to stress. And therefore, if you really taught somebody like a CIA agent how to do it, he'd be able to break the lie detector. But in a normal person, what's called cognitive behavioral therapy and biofeedback are tools of the not necessarily a psychiatrist or a psychologist, but the counselors and so forth can teach you biofeedback, how to relax or how to whatever, and lower the awareness of and the troubles with tinnitus. My mother had severe tinnitus when she was about 60, and when she went out to Emory to the world famous vestibular guy out there, and he went over, he said, "Carolyn, I hate to tell you, but this is not due to any, you weren't around big noises, you're not a shotgun shooter, you don't listen to loud rock music. You're gonna start losing your hearing, because this is the warning sign of early degeneration of the nerves that make hearing. And when you start losing your hearing, you need a hearing aid, your tinnitus is going to get better." And lo and behold, within a year, Mama needed a hearing aid, and the tinnitus went away. So yes, there are things that can be done, and no, the chemotherapy didn't have anything to do with it. But this is one of those conditions that we really don't have much of a fix for. And I hate to tell you that we don't have a fix. But that's got enough for you, Lonnie? All right, got it.
Interesting.
Well, it is interesting.
Well, I don't want to. I sit here and I think, do I really want to go into hearing and loss of hearing? And I think that's like on the top 5 list of husband and wives. Like wives say, you need to get an appointment, check your hearing.
Yeah.
And then it's possible, not myself, obviously, it's possible maybe you're not listening.
Yeah, it's selective hearing loss.
You understand? So I'm thinking I've really already said more than I should have. So I was thinking.
I love that great commercial used to have where the guys got stopped by the policeman for speeding, and he's leaning in talking to the guy that's driving, and a wife is answering the questions, and it says some people carry their hearing aids with them.
There you go.
Yeah, and the wife starts answering all the questions. The husband needs a hearing aid. So anyway.
Not to go too far, which this is one of my, I tell you this, why can I not just shut up when I need to? I do turn the TV up, and and I'm being told by somebody, why do we have to listen to the TV that loud? So.
Have the same problem in my house.
Okay, we'll leave it there.
All right.
Done. Finished.
All right, good.
There's a time to get out, and that was it.
Yeah, we had it. All right.
Dr. Whaley, what is going on out there in the medical world or anywhere in this country that you always want to bring your audience?
Well, I briefly touched on this last week, but you don't have to look out this door or that door or any intersection in the mountains up here or anywhere in the South. I don't know how it is anywhere else, where you will not see a dollar store or a Dollar Tree or a dollar type store.
My favorite kind of store starts with $1.
It is. I like that kind of store myself. The FDA is all over the dollar store manufacturers of all of the drugs that they are selling in there. And I've in the past said here, I've been guilty of it, that the cheapest over-the-counter generic antihistamines are at the dollar store. And unfortunately, I have to tell you now, don't buy any of your drugs in the dollar store. And any of the dollar stores that brand of drugs in the dollar store. They got the other
Not
brands.
all the brands. If you're standing at the shelf and you see reputable, we'll leave it at that, brands.
Right.
And then the next one, the generic is.
It's got a dollar
label.
store manufacturer, and you turn it over, it says made in China, because they're made in China. The contaminants in them are almost like what we're hearing with vaping, and they got hunks of metal in there, and they got insect parts in there, and
Actually, I've heard that.
Yeah, all right. Yeah. So let's don't mess with that one.
Okay.
All right, and the next thing is that I have frequently said that. Matter of fact, off camera before we began, I was talking about how much sleep people need.
Yeah, I agree with that.
Okay, a study came out just yesterday that this study, the last one we talked about was adolescents and taking their phones to bed with them and having them ding all night long. and interrupt their sleep. This is all adults, and adults over the age of 25, and the amount of adults over the age of 25 whose sleep patterns have been deteriorating down, not an individual, but a population of people, is dramatic. And that is leading to more high blood pressure, peptic ulcer disease, irritable bowel syndrome, rheumatoid arthritis, autoimmune diseases. In other words, lower amounts of sleep can induce this type of reaction in you. And not only that, you can fall asleep at the wheel and drive off the road. And what are they blaming it on? Are they blaming it on coffee? Are they blaming it on, Lonnie, listen, are they blaming it on coffee? Are they blaming it on energy drinks? No. What are they blaming it on, Ronnie? What is interfering with sleep so much so now, you're holding it in your hand? Technology, that's right. Either the cell phone or the game, and leaving the cell phone on at night, even if you don't wake up enough to know that it went ding ding because you got a text or some sort of message. So I hate to keep coming back to this, and you're the technology guru. I mean, you got a phone on the floor, you got a phone over here. This is the new computer, the big one sitting over there. You got too much stuff here.
All right, so now we can't get away from this. Every time you bring this up, I want to talk about it, and we're going to do it today. First of all, I will let the audience know, and you know, I have changed my habits at the house, my sleep habits. This volume goes off, and it goes like that.
So the light doesn't flash.
And in the middle of the night, if I get a message in the middle of the night, because I do, it doesn't illuminate, because I do understand, although I'm asleep, every time that illuminates, it's interfering with the actual sleep.
Yay.
No, I tried. But now I want to put this by you. So we'll just call it 1970 something. We'll leave it at that, okay?
All right.
Now, I had a transistor radio, a little transistor radio, right? And I'm not exactly from here. Let's not go there. And as a young kid, I loved to go to bed at night. And I love to go to bed at night and listen to WABC out of New York and listen to the New York Knickerbockers. Now, you'll call them the Knicks, they're the Knickerbockers. So when I was a kid...
Well, we used to listen to WWV in Wheeling, West Virginia. It was country music.
No, trust me, I got that one too. So what I'm saying is, I'm talking as a young kid, I probably went to bed every night with a transistor radio on. And I got used to that. And there was a period of my life that it's like almost I couldn't fall asleep, or I told myself that without a radio being on at night. I mean,
Yeah.
I just had to share that.
I understand. I used to listen to the Red Sox in Georgia.
We're gonna take all week to see if you can come back next week now, because you said Red Sox. We were fine. You and I were just like that. All of a sudden you say that and you ruin everything.
All right.
No, but I just every time you say that and interference in sleep, I wanted to share that. You know, one of the fondest memory I have as a kid is and when they played on the West Coast.
Was about that big.
Yes, sir. My transistor radio.
Transistor radio.
And my mom would yell, "Turn that thing off!" And I'd have to hide it.
I'm a lot older than you. We had those in Vietnam, small transistor radios, and we could listen to Armed Forces radio.
Right.
And you've seen all the movies of the guy of the Vietnam music, but the radios they had then were those small.
I had to hide it down. Mom would yell,
Under the
"Turn
pillow.
that thing off!"
Under the pillow, yeah.
And I'm listening to the Knicks that were playing on the West Coast, right? Thank you, Dr. Whaley. I appreciate it. But every time, and I want to say, every time he gives advice concerning sleep and your sleep patterns, he's 100% correct. I mean, I'm trying to make sure that throughout the week that I'm averaging 7 hours. Okay.
When you get to 7 3/4, you'll be better.
But there's been days where there's been 5.5 and 6. But I'm trying to make sure that, and I'm trying to make sure I have no interferences throughout the night.
Good. All right.
Okay, and I appreciate it, and he's right about it. Tell the kids, turn it off. All right. And he went. What do we have here from?
You keep talking about not enough. Can you get too much sleep?
Can you get too much sleep?
Actually, no, because your body will wake you up, and you can't catch up on weekends. Now, if you're actually getting pathological amounts of sleep. You might be hypothyroid or have some disorder, but if you go to sleep and you sleep until you wake up, and this is day after day after day, then you're going to sleep somewhere around 8 hours to 8.5 hours if you're in your age group right there.
Yeah, your body. So what Lonnie has asked is there too much sleep? You're outside of a medical condition.
Yeah, or lazy.
Right. Well, I don't know about that. Don't want to go there. But your body will wake you up.
Yeah.
So if you and the other thing, I like the way you threw that in there. A lot of our viewers maybe are out there and they're busy all week and they think that the weekend they catch up on their sleep.
Can't catch up.
You don't catch up on it.
No, you don't.
All right. Thank you, Dr. Whaley. Hey, don't forget, if you want to send a question to Dr. Whaley, you send it to info@fetchyournews.com. Put in the subject line, Ask the Doc. Follow us on social media, FYNTV or fetchyournews.com. You will see the Ask the Doc big logo on there. Put your question there. We'll try to find it. We keep up with that. Also, if you like the information today and you say, hey, I need to share it with family and friends because it's great information, then you can go to our YouTube channel, Fetch Your News, FYNTV, our YouTube channel. Hit the playlist. You'll see Ask the Doc. You could go through there and find so many questions that we've covered that are probably things you would like to share with your family or friend or information you may need. Again, we thank Georgia Cancer Research Center, North Georgia Cancer Research Center, affiliated with Northside Hospital for this segment. Appreciate you very much.
All right, guys.
All right, it's time for the All-Star Political Panel. And as I always say, wonder if we'll have something to talk about. Take us a break, Lonnie.